Okay. Hi, I'm Hayden Howlett,
I'm Jordan.
and we are presenting our History Behind the Headlines project on gender and pandemic/epidemic response. So our headline is Women's Periods May Be Late After Coronavirus Vaccination, Studies Suggest. So after receiving a dose of a COVID-19 vaccination, women across the world began reporting erratic menstrual cycles. These menstrual cycles had symptoms such as heavy bleeding, intense cramping, while others reported that their periods were late. Some postmenopausal women who hadn't had a period in years were actually starting to experience menstrual cycle. Studies began to research the correlation between the COVID-19 vaccination and irregular menstruation. After a substantial amount of menstruating persons began to notice a drastic change in their cycles, they began to question the effects of the vaccination on their body. The question of the effects of the COVID-19 vaccination on fertility became a large discussion because women were wondering whether or not the impact of the COVID-19 vaccination would hurt their body, would lead to infertility in the future, or just mess with their period cycles overall. Because of this, women were opting to not receive the vaccination because they believed that there hadn't been enough research done that would have prevented a sex-specific side effect. This was a large social issue because if a minority of a community becomes untrusting in the medical community and untrusting of vaccinations in general, there's going to be a minority of people within the community who are unvaccinated and more susceptible to COVID-19. Because of this, doctors and scientists from Oregon Health and Science University were not expecting the side effects of the vaccination that were being presented. So they decided to curate a study to better understand this phenomena. So researchers looked at records from about 4,000 women who had tracked their menstruation in real time prior to getting their COVID-19 vaccination. About 2,400 of those were vaccinated against the coronavirus, and about 1,550 were not. All were United States residents who were aged 18 to 45 and had logged their periods for at least 6 months. The reason they chose this age range is because menstruation typically occurs in a woman who is aged 18 to 45. For those who were vaccinated, the researchers examined the 3 cycles before and after the vaccine to look for changes. And they compared them with a similar 6-month duration in women who did not receive a vaccination. Overall, the vaccination was associated with a full day's change in cycle length. On average, after both of the vaccine doses compared with pre-vaccine cycles, there was a full day's change in a menstruating person's cycle length. And the unvaccinated group had saw no significant changes over the 6-month duration of the study.
For our historical parallel, we are going to talk to cholera and how cholera and gender worked and so how they were affected. So cholera is a waterborne disease that you contract through unsanitary water sources. It is as far back as the 1600s. Symptoms can include severe diarrhea, nausea, vomiting, stomach cramps, and muscle spasms. For our first historical parallel, we're going to discuss women's healthcare in wartime Chongqing. During this time period, men became sort of the front runner in healthcare because they had to be in the military. They needed to be healthy to fight. Women got put on the back burner unless they were specifically dealing with childbearing issues or they were giving a birth. That was because that was what they were put in society to do during this time period. They wanted healthy women to give birth, and basically, so because women weren't really encouraged to go to hospitals unless they were actively giving birth, they lacked the access to vaccinations, like the one from cholera that would better protect them from other cholera and other diseases like that. And the issue was the issue was really bad because like even hospital staff sort of would skew reports of vaccinated women so that society couldn't show that women were healthy and were able to give birth. And they just assumed that because of society's want for women to give birth, that this was like fine and it was okay.
So our second historical parallel that we are going to be talking about is the epidemic of cholera in Haiti in 2010. So at the time of this study, nearly 2,000 men, women, and children had already died in the cholera pandemic in Haiti. At the totality of the death rate during this epidemic was closer to 3,500, but the study still reigns true. And the study then found that there was a higher disease burden among school-age girls and adult women during this cholera epidemic because of their increased occupational exposure, because women and girls are responsible for a disproportionate amount of the domestic work to prevent and respond to cholera. So this looked like fetching and treating water, preparing food, and caring for sick family members. And a very telling quote that I found within this study was, "Women and girls are disproportionately affected by a cholera epidemic. Gender roles influence where and how people spend their time, which can result in different patterns of exposure to cholera, disease incidence and outcome, and responsibilities within families to prevent and respond to cholera." The social repercussions of the Haiti cholera epidemic of 2010 led to vaccine hesitancy and distrust in medicine, which we saw both of these with our original headline. And then there was also a higher sickness and mortality rate in women. For women specifically, there was a higher disease burden because women and girls had a heightened risk of coming into contact with high infectious dose of cholera through their domestic roles. And then there was also emotional, physical, and socioeconomic toll and gender roles in cholera prevention and response because of their roles as primary caregivers of sick family members, because they were food preparers, water fetchers, and so on. The division of labor during a cholera epidemic fell particularly hard on women and girls. And that then created a gendered response to the epidemic.
So to conclude, gendered issues during the spread of disease, especially pandemic epidemics, allow for women to be put at a higher risk for certain diseases. Pushing women into different roles and not allowing them to sort of get the healthcare that they need allows them to become hesitant to get healthcare at all. It causes them to distrust the medical system, and it causes them to not even use the access that they do have to get vaccines to be healthy. And this is our work cited.